Everything looks good. Perfect. All right. So the next thing I'm going to go ahead and do is I'm going to test, bilaterally palpate your temporal pulse right here. Just to feel it. That's good. And it's a 2. That's awesome. All right. And then also while I'm here, I'm going to be testing cranial nerve 5, which is your transgeminal nerve, which is responsible for many things. But really I'm looking at the mastication aspect of that, okay? So the way I'm gonna do that is I'm going to ask you to please bite down hard, like you're biting down on something. And then I'm gonna feel your masseter muscle. It's a nice ball, good. And then I'm gonna feel your temporal muscle, and that's good. And then would you please open your mouth against mine? Perfect, awesome. All right, so the next thing I'm gonna do is I'm going to go ahead and test your temporal jugular muscle. So I'm gonna go ahead and just go like this, and if you please open and close your mouth. I'm testing for any I'm looking for any popping or clicking. I don't feel any of that, which is great. Awesome. I'm sorry, it's your temporal mandibular joint. That's what it's called. Temporal mandibular joint. All right, and so after that, I'm going to go ahead and palpate your sinuses real quick. Are you having any tenderness with your sinuses? No? Okay, so just let me know if you feel any pain or tenderness. Any there?
No.
Okay, and then the frontal? Any there?
Nope.
Perfect, awesome. All right, so what I'm gonna go ahead and do now is I'm going to inspect your eyes. Are you having any problems with your vision? Are you seeing halos around lights, anything like that?
Nope.
Any watery discharge, itchiness, redness, vision changes?
No.
Perfect, all right. So what I'm doing now is I'm just gonna be inspecting your eyebrows and your eyelids. I'm looking for any kind of swelling, any abnormal crusting, anything that would be like looking, that it would be drooping or anything like that, and I don't see any of that. I'm also looking at your sclera, making sure it's nice and white, and it is. I'll be looking also at your iris and your pupils, making sure that they're evenly dilated and that they're regularly dilated. I'm also looking for any strabismus, which is cross-eyed, and I don't see any of that. And then I'm looking for anoscoria, which would be unequal dilation, and I don't see any of that either, which is great. Okay, the next thing I'm gonna go ahead and do is I'm going to inspect your conjunctiva. All right, so what I'm gonna do is I'm gonna pull your eyelids down, and if you would just please look up for me. Go ahead and look up. Just making sure they're nice and pink. And they are. Very good. All right, so the next thing I'm going to test is cranial nerve 3, 4, and 6. And so cranial nerve 3 is your oculomotor nerve, cranial nerve 4 is your trochlear nerve, and then cranial nerve 6 is your abducens nerve. And the way I'm going to do that is a series of tests. And that first test is using my pen light. And so what I'm going to ask you to do is please just stare at my pen light. I'm holding it 12 to 14 inches away from your face, and don't move your head as I move the pen light in the 6 cardinal fields of gaze, okay? Very good, awesome. Okay, the next thing I'm going to do is make sure that your pupils react to light well. So how I'm going to do that is I'm just going to dim the lights here, and that's going to dilate your pupils. So I'm just dimming the lights. And then I'm going to shine my pen line in at the sides and make sure that your pupils constrict evenly. All right? Okay, so the lights are dim. I'm just going to go ahead and shine my pen light and constrict, constrict. Good. And then the next side. Constrict and constrict. Very good. Awesome. Okay, so the last thing I'm going to do for your eyes is I'm going to hold this 12 to 14 inches away from your face, and then will you just please follow it with your eyes. Very good. Awesome. All right, and you said no abnormal vision changes, correct? Okay, perfect. The next thing I'm going to go ahead and look at is your ears. And are you having any issues with hearing? Are you having any pain or tenderness in your ears? Any ringing?
Nope.
Okay, perfect. So I'm just going to go ahead and inspect the outside and make sure I don't see any bumps or lesions, any abnormal growth, anything like that. It's not red, and I don't see any drainage. I'm just gonna palpate the tarsus right here. Do you feel any tenderness? Palpate the mastoid process. Do you feel any tenderness?
No.
Okay, perfect. All right, so I'm just gonna go ahead and check the tympanic membrane real quick, make sure that's intact, that's good. So I'm gonna pull the pinna up and back. And that looks good, all right. Okay, and I'm gonna do this other side here. All right, I don't see any redness, I don't see any abnormal growth, I don't see any drainage, just palpate this right here. Good?
No pain.
No pain, good. No pain here?
Nope.
Perfect. All right, I'm gonna go ahead and pull your pin up. And that looks good. Awesome. All right, real quick, I'm just gonna test cranial nerve 8, which is your vestibulocochlear nerve. So what I'm gonna do is I'm gonna include one ear and whisper on this side, and you just have to tell me what I said, okay? Green tree.
Green tree.
Very good. All right, on this side. Bumblebee.
Bumblebee.
Very good. So that cranial nerve's intact. Awesome. All right, the next thing I'm going to be inspecting is your nose. Are you having any trouble with your nose? Any drainage? Your sense of smell still seems intact?
Mm-hmm.
Okay. Any abnormal bleeding?
No.
Okay, perfect. All right, so your nose is nice and aligned. I'm going to go ahead and ask you to please occlude one side of it and breathe out. Good, and with that breath. Good, so the patency is good. All right, I'm going to go ahead and check the inside and just check for a deviated septum or any polyps or anything like that, okay? All right. And that looks good. All right. Real quick, I'm just going to go ahead and test cranial nerve 1, which is your olfactory nerve. So I'm just going to ask you to close your eyes, please, and then I'm going to grab something and ask you to smell it for me, okay? I'm grabbing a cup of coffee, and it's under your nose.
Coffee.
Perfect, and that is intact. Wonderful. All right, so the next thing we're going to do is I will be looking at your mouth, inspecting your mouth. I'm looking at your lips, making sure they're nice and pink, that they're the right color. Blue lips could represent low oxygen. There's no abnormal dryness, doesn't look dehydrated. Okay, looks good, no abnormal drooping. All right, I'm going to ask you to, well, first I'm going to test cranial nerve 12, which is your hypoglossal nerve. Will you please stick out your tongue and wag it side to side? Very good, thank you. That's intact, good. All right, so please go ahead and open your mouth, and I'm just going to inspect really quick for any lesions, lumps, any abnormal redness. I'm going to make sure the mucous membranes are nice and moist. All right, and then I'm gonna, while I'm here, I'm gonna test cranial nerve 9, which is glossopharyngeal nerve, and I'm gonna just ask you to say ah.
Oh.
Very good, and everything looks good there. Perfect. All right, you can go ahead and close your mouth. Very good. All right, the next thing I'm gonna go ahead and look at is your neck. And so I'm just making sure, well, first of all, have you had any tenderness or any kind of stiffness in your neck?
No.
No, you're actually able to move it pretty well?
Mm-hmm.
Okay, so I'm going to test cranial nerve 11, which is your accessory nerve. Will you please move your head side to side? And then up and down. Perfect, all right. I'm looking at your trachea, inspecting it, making sure it's nice and aligned, and that I don't see any abnormal lumps or lesions, which could represent a goiter, thyroid problems, stuff like that. And so what I'm going to do here is I'm going to just go ahead and palpate your trachea around your thyroid and make sure I don't feel anything, all right? Would you please tilt your head up a little bit? Thank you. I'm just going to palpate here. I don't feel anything. That's great. Okay, perfect. All right, so the last thing I'm going to do is I'm going to go ahead and test, feel some lymph nodes to make sure I don't feel any inflammation, okay? All right, so I'm going to start here, which is your preauricular. Any tenderness? No. And here, which is your postauricular? No. Occipital? Okay, good. And then parotid?
No.
All right. Okay, so you didn't feel any tenderness there?
No.
Okay. Are you
So first one I'm going to check is your scapula. So I'm just going to move your scapula up towards your ear and back down, okay?
Okay.
Then I'm just going to be moving your arm forward and back, okay?
Okay.
Now for the shoulder ones, for all the movements, I'm just going to make sure, have you make sure that your thumb is always facing up, okay?
Okay.
So thumb facing up for this one. Does that feel okay?
Mm-hmm. Nice.
Okay, good. Go ahead and face that way a little bit. Just turn a little bit.
Mm-hmm.
Good. You can face back towards the
Okay.
front. All right. Thumb up once again.
Okay.
I'm going to bring your arm out here, okay?
All right.
Okay, I'm going to bring your arm up once more.
Okay.
I'm just going to bring it across your body.
Okay.
Still doing okay?
Yeah, fine.
Very good.
Okay.
Okay, now I'm going to check your shoulder internal and external rotation. So I'm
Okay.
just going to bring your arm up like this.
All right.
Sort of make an L with your elbow. Very good.
Mm-hmm.
Okay, I'm going to bring your arm up. Any pain here?
No, feels good.
Go ahead and relax.
Okay.
Okay, now I'm going to check your shoulder flexion and extension.
Okay.
So go ahead and have your elbow by your side there.
Mm-hmm.
Okay. And that feels okay?
Mm-hmm. Fine.
Good. Okay, I'm going to check your forearm rotation now.
Okay.
So keep that elbow right next to your side.
Okay.
Very good.
Okay.
Okay, I'm going to check the rest of your wrist and finger range of motion at the table. So we'll go ahead and move over there.
Okay. Sounds good.
Okay, Kevin, I'm going to go ahead and check your wrist and finger range of motion.
Okay.
I'm going to start with wrist deviation.
All right.
Does that feel okay?
Mm-hmm. Fine.
Okay, good. Go ahead and flip over your hand. I'm going to check your wrist flexion and extension now. So I'm
Okay.
going to bring your wrist up. How's that?
Good.
Go ahead and relax.
Okay.
Okay, I'm going to go ahead and check your finger flexion now. So we'll go ahead and turn over once more.
Okay.
I'll start with the thumb actually.
Okay.
good. And let's go ahead and make a full fist. And straighten. Very good.
Okay.
And then go ahead, or here I'll go. Very good. And then go ahead and turn your hand over.
Okay.
I'm just checking your finger abduction now, which is the separation of your fingers.
Okay.
And the adduction, making sure that they can fully close. For this one, I just want you to hike your shoulders up, and I'm gonna push against you. Resist my push, okay?
Okay.
Ready, set, go. Very good. Relax.
Okay.
So that was a grade 5, meaning that you had full strength there. For the next one, I want to check is your scapular protraction. So I'll go ahead and have you lay face up with your head on this side.
Okay.
And then go ahead and make this position with your arm. Perfect. And what I want you to do is kind of push your elbow up towards the ceiling, okay? And I'm going to push you down. Resist my push.
Okay.
Ready, set, go. Very good. Also a 5 there. Now I would like you to lay on your stomach, head facing that way so I can get the correct side. Okay, go ahead and repeat that, that position with your arm. Perfect. And for this one, I want you to try and bring your scapula together. So you're going to be kind of pulling it back up. And I'm going to try and pull you down. So resist my pull, okay?
Okay.
Ready, 1, 2, 3. Very good. Also a 5. You can go ahead and sit up. Perfect. Okay, now I'm going to check your shoulder flexion. So we're going to do that same movement position where your thumb is always facing up.
Okay.
So I'm going to put you in this position here.
Mm-hmm.
What I want you to do is try and bring your arm up. I'm going to push down, resist my push, okay?
Okay.
1, 2, 3. Very good. Relax. 5 there. Go ahead and face that way a bit so we can do your shoulder extension. Go ahead and bring it down neutral. Mm-hmm. What I want you to do now is you're going to be bringing your arm backward, and I'm going to be pushing you forward. Resist my push.
Okay.
1, 2, 3. Very good. 5 there.
Okay.
Go ahead and sit forward for me again. Okay, now I would like to check your shoulder abduction.
Okay.
So again, that same thumb up position. I'm going to bring you right over here. Same thing, try and bring your arm up. I'm going to be trying to push you down, okay?
Okay.
1, 2, 3. Very good. Relax. That was also a 5.
Mm-hmm.
Okay. For this one, go ahead and lay down on your back, your head facing this way. Perfect. And then your arm is going to be out like this. Mm-hmm. I want you to try and bring your arm across your body, like so. Okay. And I'm going to be pushing you down. Mm-hmm. Resist my push, okay?
Okay.
1, 2, 3. Very good. 5 there as well. For the next one, go ahead and lay on your stomach again for me. How are you doing? Okay?
Good.
Perfect. Okay. Go ahead and relax your arm down here. For this one, I want you to try and pull your arm back like this. And okay. I'm going to try and push you down, okay?
Okay.
Ready? 1, 2, 3. Very good. 5 there. Okay. Now I'm going to check your internal and external rotation.
Okay.
So you're going to have your arm like this. For the first one, try and bring your palm facing back up towards the ceiling, okay?
Okay.
Bring it that way. I'm going to push you the opposite. Resist my push, okay?
Okay.
Ready? Good. Very good. 5 there. For this one, I would like you to try and bring the top of your hand up towards the ceiling.
Okay.
And I'm going to push against you the opposite direction.
Okay.
Resist my push. 1, 2, 3. Very good. 5 there as well. You can relax and then go ahead and sit up for me. Supination and pronation.
Okay.
So I'm going to have your elbow by your side here, neutral hand. The first one we'll do is pronation, so try and turn your palm facing down, okay? And I'm going to try and resist you.
Okay.
Okay, ready? 1, 2, 3. Very good. 5. And then for the next one, try and turn your palm facing up, okay?
Okay.
Ready? 1, 2, 3. Very good. That was a 5 as well. Okay, you can go ahead and relax.
Okay.
And then for the next one, we'll do on the table, okay? So we'll go ahead and move over there. Okay, Kevin, we're going to move on to the muscle strength of your wrist and fingers now.
Okay.
So the first one I want to do is ulnar deviation. So I'm going to bring your arm up onto your elbow like this.
Mm-hmm.
For this one, I want you to try and move your hand down like this. And I'm going to push against you. Resist my push, okay?
Okay.
1, 2, 3. Very good. That was a 5. I want you to try and bring your hand up like this. I'm going to try and push you down. Resist my push, okay?
Mm-hmm.
1, 2, 3. Very good. 5 as well there. We're going to do flexion and extension. So what I want you to do is bring your palm up towards you.
Okay.
And I'm going to resist you, okay?
Okay.
Ready? 1, 2, 3. Very good. 5 there. Let's turn your hand over. Now I want you to bring the back of your hand up towards you.
Okay.
And I'm going to resist you, okay?
All right.
Ready? 1, 2, 3. Very good. 5 there. Let's go ahead and do your finger flexion. So I'll turn your hand over one more time.
Okay.
Are you comfortable?
Mm-hmm.
Okay. So I'm going to do finger flexion at each joint.
Okay.
So go ahead and flex. Perfect. 5 there. Go ahead and flex again. Good. Good strength. 5 there. And 1 more. Very good. That was a 5 at each joint there. So very good.
Okay.
Let's go ahead and do your thumb.
Okay.
So I want you to try and flex your thumb up, okay?
Okay.
Ready? 1, 2, 3. Very good. And now try and bring the tip of your thumb up.
Okay.
Okay, ready? 1, 2, 3. Very good. 5 at both those points. Good job. Bring your thumb towards your hand like this.
Okay.
I'm going to try and push your thumb out. Don't let me, okay?
Okay.
1, 2, 3. Very good. 5 there. Bring your thumb and pinky together. I'm going to try and pull you apart. Don't let me. Very good. That's a 5 there. And that wraps up our manual muscle testing.
I'm going to inspect Robert's eyes. So first of all, I'm going to have you pull down your eyes like this. Checking conjunctiva. Everything looks fine. Sclera is white. Just veins, but no abnormal findings. Good job. Now what I'm going to have you do is I'm going to have you do the 6 positions. So 3, 4, and 6 cranial nerves, which is oculomotor, trochlear, and abducent. So look at the tip of this pen and follow in whisker pattern, keeping your head still. All right, great job on that. And now what I'm going to do is I am going to assess Robert's pupil constriction to see if his pupils are evenly distributed. And before I do that, I'm going to check his pupils. So his pupils are 3 millimeters diameter, so they are good to go. So now I'm going to shine this light. So Robert, take a peek over my right shoulder. And all right, I'm going to shine this light in your eye. I had it the wrong way there. All right, I'm going to shine this eye. All right, pupils equally constrict and are equally round, so now I'm going to indirectly do it again. All right, so Right, so nothing is concerning me there. So pupils are equally dilating, and that was Perla. So I'm gonna check his accommodation. So look at the tip of this pen. Now follow it inward, and then follow it out. All right, everything is good there. No abnormal findings there. So now I'm gonna examine his neck. May I oscillate your neck, or may I palpate your neck, Roberts? Sure. All right. Actually, before I go to his neck, I'm actually going to check his mouth. So what I'm gonna do is I'm gonna get this compressor right here. And have you ever had any dentures?
No.
Okay. His lips look fine, pink, moist, not dry. So I'm gonna have you open up your mouth. Teeth, let me see your teeth, smile. His teeth are intact, tongue is pink. Give his tonsils a level 1, nothing abnormal. Everything seems to be fine. All right, so go ahead and set this down. So now that we were done with inspecting Robert's mouth, now we're gonna go down to his neck. And I'm going to, before I do this, I'm gonna go back and I'm gonna say, do you mind if I palpate your neck?
Go for it.
Okay, so I'm gonna feel around Robert's neck. All right. I did not find anything abnormal. There is no, I don't see any lesions on Robert's neck. I don't see any swelling, no signs of swollen lymph nodes. Everything seems to be symmetrical on each side. All right, that threw me off. So now I'm gonna check Robert's spine and I'm gonna feel all the way down. No signs of curvature, no signs of scoliosis. Everything seems to be fine. Now I'm gonna palpate Robert's lumbar region. Please disregard the laughing. All right. Everything seems to be good. And by good, I mean symmetrical, no curvature of the spine, and overall just good posture. So now what I'm going to do is I'm going to oscillate Robert's neck, starting with the upper area, making sure not to oscillate right on the bone. And I'm gonna do this about 10 to 12 times. So take a deep breath for me, Robert. All right, you're going across and down, across, down, across, down, across, down, cross, down, cross. All right, now let's check the mid-axillary area. All right, mid-axillary area sounds clear as well. So for my findings, everything sounds clear. No signs of like mucus in his lungs, no crackling noises, everything is good to go. So now I'm gonna assess Robert's anterior area, and I'm going to start in the clavicular area. All right, take a deep breath from me. All right, doing the same motion as I did on the posterior side. And mid-axillary area. All right, findings are normal, no crackling, breathing very clearly, and there are no abnormal findings. So now what I have you do, Robert, is I'm going to have you lay down, and what I'm going to now is cover Robert's lower half, and I'm going to cover his lower half a little bit more, and now his upper half. So I'm going to assess Robert's abdominal area. So I'm going to assess all the quadrants. And first of all, do you have any pain right now before I do this?
Nope.
Right, so I'm just going to go 2 palpations in each quadrant, each of the 4 quadrants. No pain?
Nope.
Right. His abdominal area seems to be symmetrical, no distending of the stomach, no bloating, seems to be flat, nothing to be concerned of. And his umbilical area, there are no lesions, there is no leakage, there's nothing to be concerned of there as well, no abnormal findings. So now what I'm going to do is I am going to oscillate Robert's abdominal area. So if Robert did have pain, say in the right lower quadrant, I would start in the clockwise position and start in the or in the right upper quadrant, but he does not. So I'm going to start here and do 2 in each quadrant. Right? So, Robert seems to have good bowel noises. I heard about 8 to 10 different bowel sounds, and it sounded